Hey everyone, ever wondered why those monthly cramps hit so hard and how to actually make them easier to handle? Today, we're breaking down everything you need to know about menstrual cramps, from the causes and symptoms to home care tips and ways to prevent the pain. Stay tuned, because by the end of this video, you'll finally feel in control of your cycle. Let's talk about something that affects millions of people every month: menstrual cramps. So, what exactly are menstrual cramps? Simply put, they're a dull, throbbing pain that usually starts in your lower belly. For some, the discomfort kicks in a few days before your period, and for others, it hits during menstruation. But the pain doesn't always stay in one place. You might feel it radiating to your lower back or even your upper legs. And that's not all. Many people notice other symptoms too. Things like an upset stomach, nausea, or even vomiting. Some experience loose stools. Headaches, bloating, and dizziness are also common companions. The intensity can vary a lot. Some people have mild cramps that are just annoying, while others face severe pain that can make it hard to go about daily activities like work, school, or even getting out of bed. Now here's the key. Pain during your period is completely normal. But if your cramps are severe, persistent, or interfere with your life, it could be a sign of something more serious, like endometriosis, fibroids, or other underlying health issues. And that's why understanding your body and keeping track of your symptoms is so important. In this video, we'll break down everything you need to know about menstrual cramps, from what causes them, to how to manage them at home, and when to see a doctor. By the end, you'll feel empowered to take control of your cycle and your comfort. Now that we know what menstrual cramps feel like, let's dive into why they happen. The medical term for menstrual cramps is dysmenorrhea, and yes, it's a big word, but the concept is simple. There are two main types of cramps. First, we have hormone-related cramps. These happen because of natural changes in your hormone levels. Your body produces chemicals called prostaglandins, which make the uterus contract. And those contractions are what cause that familiar throbbing pain in your lower belly. It's your body's way of preparing to shed the uterine lining, but it can definitely be uncomfortable. The second type is called secondary cramps. These aren't just from hormones. They come from problems with the uterus or nearby organs. And these can sometimes point to more serious health issues that need attention. Some possible underlying issues include endometriosis, a condition where tissue similar to the lining of your uterus grows outside the uterus, causing pain. Fibroids, tumors, or other growths in the uterus, ovaries, or surrounding organs. Pelvic inflammatory disease, or infections, which can inflame your reproductive organs. Side effects from an intrauterine device, or IUD, which some people use for birth control. Scarring from previous surgeries in your pelvic area. Understanding the cause of your cramps is crucial because it helps you manage the pain safely and know when it's time to talk to your doctor. Hormone-related cramps can often be eased with home care and lifestyle changes, while secondary cramps may need medical attention to treat the underlying problem. In short, not all cramps are created equal. Knowing why they happen gives you power over your body and your health. Now that we know what causes menstrual cramps, let's talk about who is most likely to experience them. Certain factors can make your periods more painful, and understanding these can help you take steps to reduce discomfort. Here are the key risk factors. Being under age 20. Younger people often have stronger contractions in the uterus, which can make cramps more intense. Never having had a baby. Pregnancy can sometimes change how your uterus contracts, so those who haven't given birth may experience more pain. Starting periods very early, before age 11. Early menstruation can be linked to heavier and more painful periods later on. Heavy or irregular periods. The more your uterus has to work, the more likely cramps can become severe. Smoking. Nicotine can reduce blood flow and increase inflammation, making cramps worse. High stress levels. Stress impacts hormones and can intensify your perception of pain. Trying to lose weight. Extreme dieting or low body fat can disrupt hormone balance and worsen cramps. Depression or anxiety. Mental health challenges can amplify pain signals in the body. Poor social support. Feeling isolated or lacking help can make coping with cramps feel harder. Remember, these factors don't guarantee painful periods, but they increase the likelihood. Knowing this can help you take preventative steps like managing stress, staying active, and getting emotional support. So if you notice you have one or more of these risk factors, it's even more important to pay attention to your body, track your symptoms, and talk to your doctor if your cramps are affecting your life. Knowledge is power, and it can make your periods a lot more manageable. Next, let's talk about the main signs of menstrual cramps so you can recognize them early and know what's normal. The most common symptom is a dull, aching pain in the lower belly, and it can sometimes spread to your lower back or upper thighs. In some people, this pain can be more throbbing or intense, making it hard to focus on daily activities. But cramps can come with other symptoms too, including headaches. Feeling pressure or tension in your head during your period is very common. Fatigue or extreme tiredness. Your body is working hard, and that low energy can make you feel drained. Upset stomach or vomiting. Nausea can happen along with cramps, sometimes even causing you to throw up. Loose stools. Digestive changes often happen around your period, which may cause diarrhea. Irritability. Emotional changes like feeling grumpy or short-tempered are normal. Sweating. Hormonal changes and pain can trigger sudden sweating. Dizziness or lightheadedness. Feeling faint can happen, especially if your cramps are severe or you have heavy bleeding. The important thing to remember is that everyone experiences cramps differently. For some, they're mild and manageable, and for others, they can be severe and disruptive. By knowing these signs, you can better track your symptoms, prepare in advance, and take steps to ease the pain, which we'll cover in the upcoming sections. Your body is sending signals, and listening to it is the first step toward relief. Now that we know the signs of menstrual cramps, let's talk about how doctors diagnose this condition and find out if anything else might be causing the pain. The first step is usually a physical exam. Your doctor will check your lower belly and may also perform a pelvic exam. This helps them feel for any irregularities or problems in your uterus, ovaries, or other pelvic organs. But sometimes, a physical exam alone isn't enough. That's when your doctor may order additional tests to get a clearer picture, such as lab tests. These can help rule out infections or other underlying issues. CT or MRI scans. Advanced imaging can look inside your pelvis and abdomen to spot anything unusual. Ultrasound. A safe, non-invasive way to check your uterus and ovaries for fibroids, cysts, or other growths. Cultures to check for infection. If your doctor suspects an infection like pelvic inflammatory disease, a simple test can confirm it. Special X-rays of the womb and fallopian tubes. Sometimes called hysterosalpingograms, these can show blockages or structural problems. The goal of all these steps is to find the exact cause of your cramps. This is important because the treatment may differ depending on whether your cramps are just hormone-related or caused by another medical condition. Remember, getting a proper diagnosis is the first step to effective relief, and it helps you take control of your health instead of just suffering through the pain. Once menstrual cramps are diagnosed, the next step is treatment. And the good news is there are many ways to ease the pain and get back to your normal life. Let's start with home and lifestyle treatments, which are often the first line of defense. Heat therapy. Placing a heating pad or hot water bottle on your lower belly or back can relax your muscles and relieve cramping. Massage. Gently massaging your lower belly or back in circular motions can help reduce pain. Rest and relaxation. Deep breathing, meditation, or yoga not only helps your body relax, but can also calm stress that worsens cramps. Gentle exercise. Walking, swimming, or light stretching increases blood flow and eases discomfort. Warm baths or showers. Warm water helps relax tense muscles and soothe your lower abdomen. Over-the-counter pain relievers. Medications like ibuprofen or naproxen can help reduce pain and swelling. Vitamin supplements. Some vitamins and minerals, like magnesium or B vitamins, may help reduce cramps. Diet changes can also make a big difference. Avoid caffeine in coffee, cola, or chocolate, as it can increase tension and bloating. Stay away from alcohol, which can worsen cramps. Drink warm liquids, like decaffeinated tea or soup, to keep your body relaxed and hydrated. When home remedies aren't enough, your doctor may recommend medical treatments. Birth control. Pills, patches, or other hormonal methods can regulate your cycle and reduce cramps. TENS therapy. A small device uses gentle electrical currents to relieve pain naturally. Acupuncture. Targeted pressure points can help ease menstrual pain for some women. IUD removal or replacement. If your intrauterine device is causing cramps, adjusting or removing it can help. Surgery. In cases of cysts, fibroids, or endometriosis, surgery may be required to correct the underlying problem. The key takeaway: menstrual cramps are treatable, and with the right combination of home care, lifestyle changes, and medical treatments, you don't have to suffer through them anymore. Remember, finding the right plan for you is essential, and your doctor can help tailor treatments to your specific needs. Sometimes, menstrual cramps aren't just about your period. They can be a sign of other underlying health issues that may need treatment. Here's what your doctor might do, depending on the cause. Pain and swelling relief. If cramps are severe, your doctor may recommend medications or therapies specifically to reduce pain and inflammation. Hormone balance. Birth control pills or other hormonal treatments can regulate your menstrual cycle and reduce cramping. Treating infections. If your cramps are caused by an infection, appropriate antibiotics or other treatments may be prescribed. The key point to remember: treatment is not one size fits all. Your doctor will carefully evaluate the cause of your cramps and tailor a plan that's perfect for your body and your health. This is why it's so important to talk openly with your healthcare provider. The right treatment can make a huge difference in your comfort, energy, and overall well-being. Now let's talk about what could actually go wrong with menstrual cramps. First, the good news. Most of the time, menstrual cramps themselves are not dangerous. They're a normal part of your period, even if they're uncomfortable. But here's the important part. Severe or unusual cramps can sometimes be a red flag for other health issues. For example, endometriosis. when tissue similar to your uterine lining grows outside your uterus. Fibroids, non-cancerous growths in the uterus that can cause pain and heavy bleeding. Infections, like pelvic inflammatory disease, which can affect your reproductive organs. Hormonal imbalances, which can disrupt your menstrual cycle and overall health. Key takeaway: if your cramps suddenly become very severe, persistent, or different from what you normally experience, don't ignore it. It's time to call your doctor. Early attention can help prevent bigger problems and get you the right treatment fast. Let's talk prevention. Yes, there are daily habits that can help reduce menstrual cramps and make your periods much more manageable. First up, stay active. Whether it's walking, swimming, or cycling, regular physical activity can improve blood flow, reduce uterine tension, and even help ease those cramps before they start. Next, prioritize sleep. Getting around 8 hours of sleep each night isn't just good for your energy. It helps your hormones stay balanced, which can lessen the intensity of menstrual pain. Don't smoke. Smoking can make cramps worse and affect your overall reproductive health. If you're a smoker, quitting is one of the best things you can do for your body and your periods. Finally, manage stress. Stress can make your cramps feel more intense. Try activities that help you relax, like exercise, meditation, talking to a counselor, or simply practicing deep breathing. Even a few minutes a day can make a noticeable difference. Remember, small, consistent changes to your daily habits can go a long way in preventing painful periods and improving your overall health. If you want to dive deeper into understanding menstrual cramps, there are some amazing resources that can guide you. First, the Better Health channel offers clear, easy-to-read information about dysmenorrhea, tips for relief, and when to see a doctor. You can check them out here. betterhealth.vic.gov.au. Next, FamilyDoctor.org provides practical advice from real doctors on managing period pain, lifestyle tips, and treatment options. FamilyDoctor.org. The National Women's Health Network dives into why menstrual cramps happen, what's normal, and what could signal a bigger issue. Learn more here. nwhn.org. And finally, NHS Choices offers reliable, evidence-based guidance from the UK's National Health Service, perfect for understanding both common and severe menstrual pain. nhs.uk. Remember, knowledge is power. Exploring these resources can help you better manage your periods and know when it's time to get help. Thanks so much for watching our deep dive into menstrual cramps and how to manage them. We hope you now feel more empowered to understand your body, ease the pain, and take charge of your health. If you found this video helpful, smash that like button and let us know in the comments which tip helped you the most, or if you have your own remedies to share. Share this video widely with friends, family, or anyone who could use some relief and knowledge about menstrual cramps. Knowledge is power, and together we can make periods less painful and more understood. Don't forget to subscribe to our channel for more simple, life-changing health tips, and hit that notification bell so you never miss a video that could make your life easier. Your health matters, your voice matters, and your comfort matters. So let's keep learning and supporting each other. I will see you in the next video.